So out in Seattle, on the sides of buses, we see these ads for do this activity, save 6 minutes of your life, live 6 minutes longer, or don't do this activity and live 3 years longer. What do you think will really make it real for people to start engaging more with wellness and really not become reactive, like, oh my God, I've got this disease, I'm going to die?
Right. I mean, there have to be two things, and one again comes from the storytelling and the kind of national consciousness. Those things, for example, the view towards smoking was a national campaign and a national consciousness that really helped to change people's perspective. I love old movies, and I was watching this old Turner Classic movie the other night, and it was fascinating because the woman was, she was a college student and said, we were at a bar, and I think I'm pregnant, and so she's having a beer, and the boyfriend is smoking a cigarette, says, "It's okay, honey, we'll get through it." Gives her the cigarette, she starts smoking it. You realize, wow. But, so basically we've changed our perspectives on smoking, and it was a national consciousness to do that. And also same thing in breast cancer, where that has not happened in prostate cancer, for example. So prostate cancer is siloed, as opposed to breast cancer, which has a kind of a national consciousness of trying to combat it. So we need to do that in relationship to wellness. It has to be done in schools, it has to be done in churches, mosques, temples, wherever you may be. It has to be done across the board, and an implementation of nutrition and exercise and clear understanding. When it comes from the technological and the innovation side, again, one of the problems is that everyone's talking about the electronic patient record. The problem with the electronic patient record is that it is one of, I think, of a three-part conversation. If you're hit by a bus in New York City and the ambulance picks you up, they know immediately what kind of blood you have and what kind of medication and what kind of history you have. But it doesn't help you in relationship to your wellness program. So let's say that one part of a kind of a trilogy of what you really need is the story of your patient record. The second part is a kind of a personalized wellness program. Am I complying with my exercise? Am I complying with my medication if I have a genetic predisposition? And in order to do this, you have to be baseline, and that comes from your patient record. Where is your cholesterol today? Where is your blood pressure? Where are your inflammation markers? So in essence, your patient record should be feeding into your personalized record program so that they are teaching each other, one, how to get better, and also you need this kind of baseline that needs to be updated on a constant basis. And the personalized electronic record of wellness is constantly feeding into real biomarkers on your patient record. On top of that, you have a third part of that, which is information. So, for example, if you have hypertension and you are not compliant, you will receive an email immediately or some kind of messaging system that sends you to the hypertension, showing you what kind of damage you are doing to your body. So a more compelling information service is what we're doing at the Visual MD, but we're also building these two other systems. So fundamentally what we really want are non-siloed information services of my own electronic record, my personalized health plan, and the information that educates me about causes, consequences, and solutions. That for me is the kind of the use of digital innovative technology to help someone get better.
Very good. So what's the innovation that you see coming in the healthcare industry that you get most excited about?
The innovation is the fact that people are starting to use real information that helps you to understand more clearly the credible factors of how well or how not well you are, and using these to sort of get people to self-motivate to improve their lifestyles. Fundamentally, many of these issues, whether you want to say it's 70%, 80%, 90%, are self-inflicted or lifestyle behaviors. So if we can actually take on more responsibility, that again comes back to having markers that you can respond to that give you immediate feedback to the improvement of the quality of your life, which then, if in essence you are improving quality, you're improving the quality of your family's life, you're improving the quality of your community's life, you're improving the financial quality of your life, because all of these things, all these costs are going to go down.
Right.
So really, I think that these technologies have the ability to help people accept responsibility about really the costs that are increasing. Insurance companies, I mean, for example, this year, we've never really spoken to insurance companies before. They've never really been interested in what we're doing. But they can't even keep count of their actuaries and what's happening in people's lives. It's just going up every day so quickly.
Right.
So all of a sudden this year, insurance companies are really interested in what we're doing to see if we can help their clients comply so they can get a hold of hypertension, high cholesterol, diabetes type 2, obesity, all these factors that are just costing us all a fortune each and every year.
Well, really, the healthcare insurance provider should almost think of themselves as an electricity utility provider, in the sense that you have peak demand generation costs are much higher than regular costs, and in the same way, people's health, if they don't take care of themselves, then you have these surgeries and these other really big costs that come along. So
yeah, absolutely. And trying to get that mindset to change is changing by necessity, but it's always a financial necessity, as opposed to looking ahead and saying these kinds of cost-effective actuaries are better from a preventative point of view. So now all of these insurance companies are spending a lot of money in bringing in psychiatrists and psychologists and understanding behavior modifications and things, which they've done always, but just as a kind of curiosity. But all of them now are staking real claims. And the man is going after children, seeing if they can change behavior through entertainment in children of health information. So they're all starting to stake their claims, but fundamentally, again, unfortunately, it's all siloed.
Okay. Well, I think that's about all the time we have, Alex.
Great.
Thank you very much for the time.
My pleasure.
It's been a fascinating conversation. And again, this is Braden Kelley of blogginginnovation.com.